UB40's Red Red Wine. 8 minutes past 10. This is BBC Radio Kent. Have you ever been tempted to go under the knife for the sake of your appearance? There has been a sharp rise in the number of people having plastic surgery, according to figures released by the industry. The British Association of Aesthetic Plastic Surgeons says an increase in most types of procedures, from breast implants through to eye operations and facelifts. But the operation which grew most in popularity last year was liposuction, up by 43% for women and 28% for men. Have you had work done? Would you be happy to talk about it? Maybe you're considering it. Earlier, I met up with Kent plastic surgeon Marc Pacifico. In the last 6 months, he's opened up a new clinic in Tunbridge Wells. I asked him whether it was a response to demand in the area.
I opened it for several reasons. Certainly, I do agree that plastic surgery is becoming more popular. But also, from my point of view, I was very aware of people's aversion to coming to hospital, the fact that people having plastic surgery or wanting to talk about it aren't unwell, and therefore if I could provide a relaxed environment that was suitably fitted out from a medical point of view, but also balanced with a relaxed non-medical environment, that would really be desirable. And it seems to have proved to be the case, because people, certainly with their feedback anyway, say they enjoy coming to such a consulting room.
Are people self-conscious when they come to the consulting rooms? I'm wondering if people don't want anyone to know they're there. I mean, certainly when you see the pictures of celebrities in glossy magazines, and the insinuation is they're going to see their plastic surgeon, you know, they're a little bit incognito. How are people when they first come for a consultation?
Well, the consulting rooms are just on the edge of town, so intentionally in an area that's somewhat discreet, not right in the middle, not right on the high street. But also we're very conscious that anyone coming through the doors, especially for the first time, this is not something that they do every day. We've got to treat everyone as if it is a very big life event, something they're very self-conscious about. After all, on the whole, if someone's coming to see a plastic surgeon, they are coming to see them about perhaps an area of the body they're not comfortable with. They're then going to talk about that area, show that area, let it be examined, and perhaps be photographed in as part of the consultation. So it's a very a vulnerable experience for people. So we try and make people feel as warm and comfortable as possible, acknowledging all of those sorts of things. But of course, in order to help people, they have to go through that process to get to the end result that they desire. There's
a fascinating blog on your website at the moment of a woman who's undergone a breast reduction. And the honesty, I mean, the images she's allowed you to use, and the honesty is fascinating. And I imagine quite helpful to other women who are considering a similar process. How on earth did you get her to agree to do that?
Well, one of the things that I'm very conscious of, and my team are very conscious of, is we hear a part of the person's story, but there's always going to be much more, as you say, personal and deeper feelings about it. And with this particular person, who I'm eternally grateful for being so honest, it came out in a discussion that she was happy to volunteer to do that. And I must say it was very enlightening for me to read her feelings and thoughts. And in fact, since then, we've got someone who's gone through, who's done a similar diary for facelift, and we've got one or two in the pipeline for other procedures. And it is very educational, I think, for me, and incredibly helpful for other patients thinking about procedures to read the feelings and the emotions behind having a procedure, because it's something they can really relate to.
What sort of procedures do you carry out? Are you a specialist in certain areas of plastic surgery, or do you do most procedures?
I've got both an aesthetic and a reconstructive practice, and from the aesthetic or cosmetic plastic surgery, I will do most procedures, facial procedures from facelifts to eyelid lifts, abdominal and breast procedures from tummy tucks to breast plastic surgery. And on my reconstructive practice is predominantly breast cancer reconstruction and skin cancer reconstruction, which I do both privately and in the NHS, where I'm a consultant at the renowned Queen Victoria Hospital in East Grinstead.
Do you think any less of your patients who are with you for cosmetic reasons than those who are with you because they've had a traumatic life event like cancer, for instance?
Absolutely not. I never judge my patients, and it's incredibly individual and personal why everyone's there. And quite interestingly, the psychology and the emotions of someone who is coming to see me for a post-mastectomy breast cancer reconstruction, their feelings pre-operatively and their improved self-esteem and confidence post-operatively are really very similar to a lot of my cosmetic patients, because people have deep-seated, deep-rooted feelings about their body image. It could be their nose, for example, that, for instance, I saw someone last week who's in her mid-30s, and when asking her how long she'd been thinking about getting her nose reshaped, she said, well, ever since I was a teenager, it's been the bane of my life. I turn my head in certain directions when I talk to people. I make sure I'm out of photographs. And so many activity modifications are part of her subconscious routine now that it becomes a huge burden.
Do you ever say to somebody, no, I'm not going to do that, you don't need it done, or I don't necessarily think your motivation is good motivation? Do you ever turn down a client?
I do. I think part of my role and part of any plastic surgeon's role is to have a very sensitive antenna to the backstory, so to speak, and understanding what the rationale for someone coming to see you. And I think especially when the person is very emphatic about a particular deformity or part of their body that I can't as a plastic surgeon see myself or understand, then I do have I'm very careful, and I work very closely with a psychologist and psychotherapist, and every patient gets offered the opportunity to speak to him, and there are some patients such as those who I will really strongly bring it up in the conversation, although diplomatically, to see if that's an avenue we should be exploring far more than surgery.
Do you sometimes have people who come to you, are you under the impression that somebody else wants them to have the work done?
Well, I always say, I think that's a very good point, I always say to patients, this is for you, it's not for anyone else. You're the one undergoing the procedure, taking on the risk, and it shouldn't be for someone else. It shouldn't be for my husband, for my boyfriend. It's not going to save your marriage or relationship. It's got to be fundamentally about your self-esteem, your self-confidence. So yes, it does happen, but I think it happens less frequently now. I think there's much more of an awareness and an understanding about plastic surgery because of the huge amount of media coverage that there is nowadays. And
who are your clients? What sort of people come to have plastic surgery with you?
I find it incredibly interesting because there is no one stereotype. I have people of all ages from all walks of life, and of course some people may fit certain stereotypes, but there certainly isn't one particular one. If I can give you an example, I remember some years ago one of my early facelift patients, I think one would think of a stereotype facelift patient as being a 50-something divorcee perhaps. But this is someone who had a facelift previously. She came from a not particularly affluent background, lived on quite a perhaps unsafe council estate, not someone you'd expect, and she'd actually had a facelift before, and in my conversation with her, she told me something I couldn't quite believe. She said, actually, I know what it's all about, I've had it before. In fact, when I had my first facelift 10 years ago, and I had the stitches in around the front of my ears, I was stopped on my estate by someone asking, why have I got those scars? Why have I got those stitches? And she said, I had to think really quickly on my feet. I couldn't say I'd had a facelift where I was. So I had to tell the guy, someone tried to cut my ears off, and these were stitched up. And she said, not only did he believe it, but my street cred around the estate went right up, and no one ever hassled me again.
What a fantastic story. That must have really tickled you. That's one to dine out on for the rest of your career, isn't it?
Exactly.
Do men come to you in greater numbers as well?
Yes, and I mean that's something that's reflected in the BARPS statistics that have been out this week, and I certainly find more and more men, be that for facial procedures, especially upper eyelid lifts, some facelifts as well, and body contouring procedures. So I think there's an understanding that procedures such as tummy tucks and liposuction are not weight loss procedures, they are contouring procedures. So people do tend to come when they have been on sensible diets for a while, when they have been going to the gym or doing regular exercise, and they come because there are certain areas that they cannot change. They've tried very hard, and then they realise actually, quite rightly, some sort of surgery may be the only way to reshape an area that they're particularly troubled by.
Final question. I suppose about the ageing process. You're a part of our culture, aren't you, that is denying ageing, that is saying youth is, or youthful appearance is better. Does that worry you?
I think it's a very good question. I don't necessarily agree I'm denying ageing. I think there are certain aspects that trouble people with regard to ageing, which might be because of, as you say, society's perception or the cultural view that pervades society at the moment. A common comment I have from people is they look in the mirror one day and they say, who is this person 10 years or 15 years older than me looking back at me in the mirror? That's not me. I don't feel as I look. And that starts to become very troubling for people. So it comes back to plastic surgery as a whole being about self-esteem, self-confidence, feeling good about oneself. And that's how I view what I do. And the change in quality to people's life that I try to bring about, that I can bring about, is hugely rewarding. And you see people coming into the first consultation feeling slightly low down about themselves, and at the post-operative checkups they bounce out of the consultation room with big smiles on their face, and you can just see the change and the difference that's made to their lives.
That's Marc Pacifico. He's a consultant plastic surgeon here in Kent. If you've had it done, if you've had some work done, did you bounce out afterwards? Did it change your life? And I'm really interested to know what you think of your face when you look in the mirror. Marc made a really interesting point, and I'll be honest with you, I've been there on a bad day. Looked in the mirror and thought, who is that person? I don't feel as old as I look. Do you ever look in the mirror and despair that there's an old face looking back at you? Tell me about it.